Good afternoon, everyone. This is Jim Morrison, and I want to just welcome you to this call. We have a couple minutes. We still have people logging in, so we're going to give it just another minute or two. But I wanted to welcome you to the call. Please be patient. We'll get started here in just a moment. Perfect. All right, another 30 seconds or so, and then we'll get started to make sure we're on time. All right, I got 301. Let's get rolling. So first of all, good afternoon, everyone. As I mentioned, this is Jim Morrison. Also on the line is Faith Borges from California Advocates. I want to welcome you to our 2018 Legislative Update webinar. So this is a newer concept for us, so we are going to see how it goes. We're hoping that you will find the results are positive and that you get some good takeaways, and then see if we're going to do more of these in the future. So this year, more so than many in the past, we've had a significant flood of legislation. And as many of you know, it's not always a positive conversation. This year in particular, we've had just a number of bills that could have been devastating to our industry, had a significant impact on our clients, on our business operations, et cetera. And basically through the efforts of the Legislative Council for CAHU, people like Faith and Mike from California Advocates, people who attended the CAP Summit, people who have gone to offices and met with members and explained the circumstances in which these bills and the impact these bills can have, as well as just constituent visits in the home areas. We've had a tremendous amount of success this year in either amending or stalling or prohibiting bills from going forward that could be really detrimental to our business. So we wanted to share some of those highlights with you on this webinar. That's the purpose of this webinar. And I think hopefully you'll be able to take back to not only your own chapter, but share it with your fellow members that maybe don't participate as much, and even the non-members. Hey, what our association is doing to help us thrive in a relatively challenging state. All right, so as I mentioned, we have Faith Lane Borges on the phone. I think she said hello and I talked over her, but Faith, please go ahead and say hi again.
Hello, everyone. Thank you so much for taking a little bit of time to join us. We hope to be succinct and give you a little bit of a better idea of what you are a part of here in Sacramento. So first and foremost, to thank you for joining us, and thank you for your participation in CAHU.
Perfect. So this should be relatively short. I know it's scheduled for an hour. I would be surprised if we take half that. So we're going to go ahead and dive in. So Faith, if you don't mind going to the next slide, please. So I'm going to have Faith start with this one. For those of you who went to CAP Summit, you should recall this is one of the bills that we actually lobbied on. So Faith, why don't you go ahead and we'll get a summary and tell us what's going on with this bill, please.
My pleasure. So at both the state and the national level, there certainly is a cost surrounding the effect that prescription drugs have on the overall cost of healthcare and then subsequently the cost of premiums. So CAHU took a proactive position this year to support a bill by Assemblymember Nazarian. This is AB 2863 that we think just makes a lot of common sense. It limits the amount that carriers can require beneficiaries to pay for prescription drugs at the point of sale, making sure that it's not more expensive than the retail price. So sometimes this is called a clawback when there would be a higher charge than was available for the cash price. But maybe even more importantly, it would also require that the amount that is paid for that prescription to count towards the beneficiary's deductible or out-of-pocket maximum. So a huge advantage to CAHU clients and consumers, and we're hoping that by making it so consumers can pay the least amount, that it'll have a small impact, but a positive one nonetheless, on the effect that prescription drugs are having on overall premiums. And it has advanced all the way through the Assembly, through Senate policy committees, and is currently on the Senate floor.
Perfect. Thank you, Faith. So this is one, just to give you another quick example on this one. Many of you have clients that have prescription needs, and it's the $4 generic, but their copay is $10 or $15 on their health plan. This would allow the $4 to be charged and that $4 to apply towards the max amount of pocket. When we lobbied on this bill, we got a lot of positive feedback. I don't think there's much opposition from anyone involved in this one, but it's to show the consumer advocacy component, very positively received. And again, I think this one is going to head down a positive path. Faith, anything else on this one before we get into the real meat of the program here?
Nope, just that we're highlighting an effort to promote transparency in healthcare systems and improve affordability, and this bill does both.
Great. Perfect. All right, next one, please. So this next bill is Senate Bill 1008 by Skinner. This is also known as the dental loss ratio bill. This bill in its original form would have mandated a 70 to 75% loss ratio for all dental plans. For those that know anything about dental, especially when it comes to the prepaid and some of the lower cost items, this would have been devastating. This would have pretty much killed that entire market. So through, again, the efforts of all the parties I mentioned before, that bill has basically morphed from a dental killer into really kind of a dental information bill. This would require the plans to create and complete a prototype, so to speak, that is a government document, and it would basically provide all the information on the out-of-pocket costs, medical loss ratio, and other things. So it's really become a kind of an information bill. So it went from potentially being a detrimental bill to really just information that they file with the state. We think it's a huge win, and we wanted to share this with you. Faith, anything to add on that one?
Nope, I think you did a great job.
Cool. All right, next one.
So this next bill, in a similar vein, pertains to the medical loss ratio, but for the medical side of things. So when the Affordable Care Act was enacted at the federal level, a medical loss ratio was established, which is basically a mandate that a percentage of the premium dollar that needs to be spent on direct medical care versus administration. And those rates were set at 80 and 85% respectively. But this bill by Assemblymember Arambula, as originally introduced, was requiring a 5% increase in the medical loss ratio, so in that direct payment for medical services, but really squeezing that existing 10 or 15% for administrative services, that we took a hard line opposed to, with the overall perspective that it could and very realistically would lead to fewer health insurance carriers in our state, which has been a pretty large part of the overall success that we've had here. It would create market instability and may even have an unintended consequence of increasing premiums, because insurers might have to raise their overall premiums to meet that threshold to cover the administrative portion of costs. And most importantly for our membership, this would have reduced access to coverage and also the advocacy services of our agents, because that is, of course, included in the administrative side of things. So this bill was eventually amended to now just codify the existing medical loss ratio standards of 80 and 85%. And I'm not sure if, Jim, you want to add on to that there.
So when we first saw this bill, this, as you can imagine, would have been horrendous. It basically would have, frankly, wiped out the individual market. There would have been no agent compensation. Not that it's high now, but it would have gone from the 1 to 3 to 0. In addition, it just, there's so many just negative things. So with a just all-out blitz of information, coalition partners, Faith knocking and meeting with every single person she can on a regular basis, we were able to get this to basically putting out putting a lot of us out of business to really just aligning with what is federal law. So a significant change for the positive. And so, again, there's always things we want to improve on, but this could have been detrimental to our industry. So this was a huge, huge win to basically get the MLR piece knocked out. And this just, as Faith said, basically just aligns with federal law. So this was a major, major victory. Next one, please.
And this one did require, we met with nearly all of the members of the assembly, trying to educate them on first of all, what a medical loss ratio is, and then also the really great things that are included in the administrative cost portion, such as fraud, waste, and abuse studies, improving network management, quality and outcome analyses, and of course, the valuable services that agents are able to provide to their clients, many who serve in an HR administrative type role for smaller businesses, and then of course as a consumer advocate for their clients when coverage disputes arise.
Absolutely. And I would say most members on both sides of the aisle saw that and saw through and saw the value that we provide. So again, another byproduct or a positive element that came out of a potentially devastating bill. All right, next one, please. So, AB 3087, this one was an interesting one by Carla. This would have basically created a commission to set all pricing for all medical services, whether it's a hospital, doctor, what the insurance companies would pay, et cetera. So it essentially would have been the ultimate in Big Brother or government intervention to set, manage, and control all pricing in the state. And so we circled the wagons on this one. We basically explained, some of the devastating things that could have, the impact that it could be imposing on the clients, the providers, all these different things. And we were able to get this from basically held. So essentially did not go forward. Huge victory for, again, our association, as they could have mandated commissions down to 0, 1%, 0.5%. They could have done every single thing would have been set by the government. And so this was scary and would have basically probably been very detrimental, again, to our industry. Now we were able to essentially get this one held or defeated. So, Faith, anything to add on 3087?
Yeah, we also use this bill as another messaging platform to really reiterate to members of the legislature that CAHU agrees with the objective of containing costs and improving quality, reducing disparities, but that we wanted to make members aware that there would be a number of unintended consequences with this particular method of doing it. There was a lot of comparison to what Maryland's commission does, because they have a commission and you'll frequently see that cited in different press pieces. But I was actually able to connect with CAHU members, Maryland CAHU members, and got a lot of clarification that I was able to provide some pretty meaningful dialogue with different members. Their member only sets hospital rates and services, and it also includes federal payers, which is an important part of its success. So this bill would have not included federal payers, and it went far beyond just hospital services to what Jim mentioned, which would have also included physician groups, other healthcare providers, and health plans. So that was a pretty far reach for something that they were hoping would be run by a commission of government appointees. So the legislature would have been appointing these individuals, and it is important to note that it was pretty significantly supported by various labor groups. So there was an interesting dynamic associated with that as well. And I thought something that was interesting was that the California Nurses Association, who are the sponsors of single payer legislation in California, were actually not in favor of this approach and really spoke out in opposition, saying that the only way to control costs would be to enact single payer legislation in California. So little dialogue
in their opinion. Mm-hmm. One other quick thing, in case you're looking at this bill going, this was a missed opportunity. We talked about transparency a little while ago. we approached it from that perspective that if we could get amendments to basically use as a benchmark against Medicare or some other published items to provide additional transparency, and the author was completely unwilling to engage in those conversations. So, but just know that we were thinking along those lines of, hey, how can we pivot what is arguably a terrible bill into something positive, such as transparency, et cetera. And unfortunately, it didn't go our way there. But the end result is we got what we wanted, which is this bill to not go into place.
Yes, it was held on the suspense file in the Assembly, which for those of you tuning in, if you see that and you're like, what does that mean? Any bill that has a fiscal component is referred to the Appropriations Committee, and the legislature holds all of the bills that cost over $50,000 or $150,000 in the Assembly, and the 50 is for the Senate. And then once they have a look at what tax money has flowed in that year, legislative leadership will design a list of priorities and decide what bills get to advance to the floor for a vote. So based on leadership priorities and the overall cost and what resources are available, that makes that determination. And of course, when folks like our group are able to go in and make these positions to really highlight what some of the unintended policy consequences would be, that bears great weight on those decisions. So that's the suspense file.
Great. Why don't we go to the next one, please, Faith? All right, take it away, Faith.
Okay, many of you have heard of SB 562. The proponents call it the Healthy California Act. We refer to it as the single payer measure here in California. It's important to note who these authors are: Senator Lara and Senator Atkins, Senator Atkins is actually the leader of the Senate. We call that position the pro tem. And Senator Lara, until very recently, was the head of the Appropriations Committee, which I just mentioned how significant that leadership position can be in determination of what bills are going to move forward. But Senator Lara is also running for insurance commissioner. So it's two pretty significant heavyweights in the legislative body that we have here. And this bill, as it was introduced, and we actually never saw amendments, so as it stands, would eliminate all private insurance, so all employer-sponsored coverage, Medicare, Medi-Cal, long-term care, the veterans, the VA, workers' compensation, medical, dental, and would incorporate everything into one giant takeover system, so a true single-payer model. Sometimes there are references made to Medicare for all. This is really a single-payer model. The bill also, I do want to highlight, provided on page 15 and 16, that anyone assisting in what are traditionally the role of the agent would only be able to come from not-for-profit associations. So it specifically excluded agents and the services that they provide within the system in this massive takeover. The Appropriations Committee, of which Lara was even the chair, identified that this measure would cost over $400 billion per year, which for context is over 2.5 times the entire state budget. So a massive, massive cost associated with that, huge change in the way that healthcare is delivered. And at the state level, really something that would make the legislature very vulnerable, because California cannot deficit spend in the way that the federal government can. So you really would be looking at cuts to other programs like education or infrastructure, et cetera, to pay for that. But we did see this bill advance all the way through the Senate over to the Assembly, where it was ultimately held in the Rules Committee by the Assembly Speaker, Anthony Rendon. So a big victory overall here, and definitely a renewed conversation around the topic that we saw last election cycle with Bernie Sanders and Hillary Clinton. So we don't expect the issue to die, and know that certainly as conversations continue around access, affordability, et cetera, this will remain in the mix. But we were able to really educate the legislature on the adverse impacts that this could have, and we're very pleased to see it held.
Great, thank you for that extremely polished summary. I'm going to kind of be a little more blunt. This would have been a catastrophic bill that would have put every single insurance company, insurance employee, agent, broker, it would have basically prohibited the sale of anything that the state would do as part of this bill. So it would pretty much eliminate everyone. Held in suspense and all these, or held in assembly, excuse me, is, I'm going to call it dead. This bill is dead in its current form. But as Faith mentioned, with the governor's race, we're going to be hearing about this over the next 4 to 8+ years, both on a federal Medicare for all and state level. However, we need to look at the victories that we've had. This bill did not get to a point where it was even close to getting implemented. Again, through education, meetings, sit downs, lobbying, etc., we were able to educate, and the speaker did what was, right. There's no way that there's no $400 billion sitting in a secret account that they could have come up with for the first year. And again, that's estimate was first year only. So good news on this one is this one, as the bill stands, is dead on arrival for now. We're going to be watching this as this topic is going to be coming up on a pretty regular basis. And we're going to talk a little bit more about that in a moment. All right, next slide, please. All right, so as you can see, there's always a lot going on. There's a lot of moving pieces, some good, some bad, but it's fun to be part of the process to help kind of bend the curve, so to speak, and be part of a positive outcome. So what can you do? Well, if you see a voter voice come through, whether it's a CAHU or a CAHU, please take 30 seconds and basically complete that voter voice. They're typically pre-registered with your information, a couple clicks, and we can then communicate with the members the message that we are wanting to get out. Go to Capital Summit. Capital Summit is held in May. It's up in Sacramento. You can come through your chapter, participate, even if you're not super comfortable or not sure what's involved. A, it's a fun time. B, there's a lot of meetings, so you can just sit there and watch. You can participate at the level you're comfortable with, but I will tell you, it will basically inspire you to get more involved. I think that that's one of our most fun events. We have a lot of new things coming up in this particular one in May of 2019. And so it seems like a long ways off, but I would strongly consider you to participate in that. Legislative Council. So each chapter has a legislative chair or VP of legislation, but they also have a committee. You could participate on that committee, which basically is known as the Legislative Council. In general, those participants call in on Thursdays for a 30 to 60-minute call. We talk about all pending bills, recommend positions, and then we take those to the board of directors. If you're someone that wants to get involved or be in the know, a great place to start is by reaching out to your local chapter ledge chair, I guess I should say, and then asking him or her if you can participate in the committee. And I would be shocked if they said no. It's a great way to get involved. Even if you're not someone who is passionate about legislation, if you want to know what's going on a regular basis, it's there. Along those same lines, from the Legislative Council, we put out a priority bill list, and those are posted generally weekly on the CAHU website. So we'll have a screenshot of that in a little while. And then lastly, you're going to be seeing some coalition efforts. So I'm going to let Faith take this part, but basically coalition means that we're joining forces with other groups to promote a message or get a message out. So Faith, why don't you talk about the coalition that's coming up on single payer, please?
Absolutely. So this past go round, there were many other advocates and industries that were aligned in opposition to SB 562 being the correct choice to implement reform in healthcare. So there has been a group of us, of providers, of health plans, of hospitals, and agents, and we are putting together, we've contracted with a public relations firm to kind of provide a uniform space. We are in the middle of conducting extensive polling right now, thinking groups, and forming a website where you will be able to go and sign up as a member of the coalition to get the latest information. We're collecting stories and different pieces of input there that will ultimately be used as the narrative for single payer continues into possibly the next administration, being Gavin Newsom, who has indicated his repeated support for single payer. It's going to be important for us to have kind of a form centralized platform where we can articulate that this is actually going to be a very costly and disruptive to healthcare, to the delivery of healthcare for our clients and for those who live in the state. So looking forward to that effort, and you should be receiving some information in the very near future on that.
Perfect. All right, next slide, please. All right, as I mentioned, the CAHU website. So this is a screenshot of what it looks like. It's a great resource and has a ton of information about the legislative efforts. The coalition information will be here. The priority bill list is under this. The slides from this webinar are going to be in this section. So we just wanted to point it out. If you haven't used or don't use or haven't gone to this website in some time, I would recommend you check it out. We're constantly working on the site. We're constantly looking to improve it. It is being updated on a regular basis, especially with the priority bill list, et cetera. So we just wanted to point this out so you can see the website, and then basically it's the 5th item over the legislative tab. You click on that and it'll take you to our issues, priority bill lists, upcoming events such as CAP Summit, et cetera. All right, next slide, please. All right, so questions. If you have any questions for us, we're happy to take them if you just type them in the chat box on the webinar. If you don't have any questions, that's fine, but if you do, this is an opportunity. If you don't have the time or you don't think of the question now and you want to get back to us later, you can go to the info@cahu.org. That's an active monitored email address. So I actually responded to 2 of those, or one of them, excuse me, this morning. But if you have a question, issue, whether it's legislative related, association plans, short-term medical, what's going on with this bill, or I'm going to meet with this member, any insight. Faith knows everyone and just about everything about them at that level. Between the 2 of us, we should be able to get back to you with an answer. So use the info@cahu.org or fborges@CalAdvocates, and we'd be happy to get back to you as soon as we can with the information that we have for you. So with that being said, I'm looking to see, Kimmy, are there any questions coming in?
I don't see any questions.
Perfect. Okay.
Tim, we did such a good job.
We wowed them that we've answered every question that they could possibly ask. So, well, let me just say on behalf of Kimmy, who's the Executive Director for CAHU, Faith from Cal Advocates, myself, thank you for participating in the webinar. Hopefully you found it useful. As you can see, we didn't want to just talk for hours and hours.
Jim?
Yep, go ahead.
Sorry, I spoke too soon because they started flooding in.
Okay.
All right. So the first question is, the recording of this webinar will be posted on the website along with the slides. You can contribute to CAHU if you want to email info@cahu.org directly. That would probably be the best way to start that. And the next question is, what is the stance on AHPs for California?
Okay. Do you want to take that, Faith, or do you want me to take it?
You can start and I'll add.
Okay. So association health plans are getting a lot of press right now, along with short-term medical plans because of the Trump administration. California is one of 11 states that's suing the Trump administration for some of these actions, as they look at that as basically a negative to the overall stability of the Affordable Care Act, or the ACA. So legislatively speaking, they're not in favor of them. They look at them as a negative. They remember the 80s and 90s with the MIWAs, and it was kind of the wild, wild west. So they're frankly hesitant to get on board and support association health plans. We'll see what comes out of this. The closest thing to a bill that we have on this right now, and Faith, you're going to have to refresh my memory off of it, but it's Hernandez's bill that would
SB 1375.
Thank you. That would basically remove sole proprietor from an eligible employee, and essentially it's an association kind of shot across the bow. So we're kind of taking a wait and see. Again, there's not much legislation on it, but just the general kind of input we're getting is that the insurance commissioner and the legislators are not excited about this because they think it's going to basically destabilize the individual and small group markets. That's my opinion. Go ahead, Faith, and add your commentary.
No, I think that was pretty representative. So it's important to note that the author of this bill was the previous chair of the Health Committee until very recently. He is terming out, so this was run by leadership through his committee and is pretty reflective of where we expect the administration to be. They are traditionally very focused on stabilizing the individual market, and we've had some dialogue back and forth about this being an attempt to really force folks into that market and out of association health plans and even small group in this instance.
One last comment on the association health plans is there's a lot of current legislation and rules in place on association health plans now. And so those are additional hurdles that would have to be overcome for new plans to come into place. So anyways, it's complicated. I don't see California being a bastion of new health plans, especially association health plans on this. And as we mentioned, the legislative environment is hinting that they're not going to be welcoming of this because of the destabilization. All right, Kimmy, next question.
Okay, what is CAHU's stance on short-term health plans?
I'm so happy
I can take that one, Faith.
There was another bill by the same author, SB 910, by Dr. Hernandez, that calls for the all-out elimination of short-term limited duration plans in California, even in circumstances, which has been one of our key lobbying points, that would leave a customer without any coverage options. So CAHU took an opposed unless amended position to this bill because we understand the author's intent of making sure that individuals are enrolled in comprehensive coverage. We've worked very hard at the agent level to get folks into comprehensive coverage and have not been supportive of the extreme other option from the federal level, which is to make these plans, available for 3 years and that nature. So we proposed what we think is a really good middle ground in the way of amendments, which would allow these plans to be available when there's no other coverage options. So when we're talking outside of open enrollment periods, not this plan, being marketed as an alternative, a cheaper alternative when you're sitting down with an agent. So only when there's no other coverage options, limited in duration until the next open enrollment period, and non-renewable. So we thought this was a great compromise of not really running the risk of them being used as a complete substitution for comprehensive coverage, but serving that bridge period that they were intended to create. Unfortunately, the legislature, due to reasons we just mentioned with the association health plans, was ultimately unwilling to accept these amendments, and the bill continues to move forward and was on the assembly floor today, being considered by the legislature. So we made a valid effort and actually received a lot of good traction, but ultimately this one wasn't able to get over that hump.
Yeah, the author on this bill is, as Faith mentioned, terming out of office, and I think he's trying to leave a lasting mark. And this is an area he wasn't even willing to have dialogue on. I went up and testified on this particular bill, and they use a term like junk insurance, underwriting, all these things that make it negative. They ignored the fact that there is a plausible need for this and look at it as just bad, just a giant generalization of bad. And the likelihood of that bill going through and passing is probably pretty solid, frankly. So we're disappointed. All right, next question.
Okay. If single payer came to the assembly floor, what do you think the vote would be?
I'm going to defer to Faith.
That's a great question because we didn't even get through a policy committee. The Assembly has a significantly stronger moderate caucus block of Democrats. So in both houses of the legislature, the Assembly and the Senate, there is very near 2/3 supermajority Democrats. And that's important because single payer has, in the past few years, become a party platform and is supported by the Democratic caucus platform. We've seen lots of conversations around it at their conventions, and we're even starting to see kind of a fraction, like I mentioned before, the Bernie Sanders race versus Hillary Clinton, or even at the Senate level, Kevin DeLeon versus Dianne Feinstein, where there's more of a dialogue around who's more centrist and who's more progressive. The Assembly, as I mentioned, does have that larger moderate caucus, and because the bill would have ultimately needed to find a funding mechanism for the $400 billion, it didn't provide a direct funding source in the version that went through the Senate, and I think a lot of members use that as cover to say, you know, I'm just voting for this today to allow the conversation to continue. The Assembly can figure it out on their own. With that being said, there was a lot of analysis done on this bill that highlighted a number of constitutional issues that the legislature would need to overcome, and that if you're looking at a tax increase or making changes to the Constitution requires 2/3. So I think it would have been really difficult for them to get, particularly in light of the political context where we already saw a number of tax increases go through, the gas tax, I would say, being the most significant there, that ultimately resulted in a Democratic senator from Orange County being recalled and losing his seat. So I think that served as a cautionary tale to members from more moderate to conservative districts that they would be unwilling to support something that costs this much. So I think it would have had a lot harder time making it to the Assembly floor once a funding mechanism was identified, because nobody really had the appetite for increasing taxes in an election year, particularly after that transportation tax increase.
All right. Next question.
What is an association health plan?
Okay, so generally an association health plan is put on by a group. They have to have, as a general rule, they used to have to have, or I believe they still do, a like industry, and they have to be formed for the purpose of not just insurance, but some other reason to have that association be in place. A good example would be like the California CPAs or the car dealers or the realtors. So they're in a common industry. They have other means for why the association exists other than to get insurance. And then what would happen in most cases, the association would negotiate with a health provider and come up with a plan for its members. And one of the benefit perks of being a part of that association is you would have access to this health plan. So in many cases, it might be a large group platform or composite rates. It could be large group benefits, even though they only have 5 or 10 members of their company. So that would be the advantage. Like anything else, it's not perfect. So just because it's bigger in a large group platform doesn't mean it's better overall. But that's the purpose of the association health plan. It's a Republican concept that has kind of come and gone in California. And it's not this, in my opinion, I humbly believe this is not necessarily the perfect solution that's going to change everything. It's a potential option, but it's not this, idea that's going to save the world when it comes to health insurance. All right.
Okay.
Faith, anything to add, or you want to go to the next question?
No, other than to say that there was an executive order by the Trump administration that issued a proposed rule that would modify ERISA to amend the definition of employer, making these plans more available, making them more aligned with large group. So California, for anybody that reads the newspaper or Twitter, has a pretty strong polar opposite reaction to anything that the Trump administration does. It doesn't matter what it is. So this is certainly a part of that from a political level.
Great.
Okay.
Thank you, Faith.
Mm-hmm.
Right,
so any update on HRA allowing employers to pay individual premiums?
The short answer is no. That's a federal piece. And so my understanding is there's no movement on that at this point. Now there is and has been, just came out of the House, some HSA related legislation that is going over to the Senate side, but I don't believe it had any components of HRA paying for individual other than that what's currently on the books. So with that, thank you for the questions. Good questions. Hopefully you found this topic or this webinar helpful. We wanted to emphasize the positive results that basically we as an organization have had this year. We wanted to make sure that you guys are aware of this. Sometimes the message doesn't always get communicated out. So hopefully you found it helpful. Hopefully you saw the value that CAHU is bringing in all these wins. And, we're here for you. So let us know if you need anything. But thank you for attending. Faith, thank you, as always, for your tremendous input. Kimmy, thank you for organizing all this. And that's it. It's a wrap. Thank you again for attending the webinar on 2018 legislative status. Have a great afternoon, everyone.